The Home Health Quality Improvement National Campaign welcomes you to the second of a two-part clinician educational video on lifestyle modifications to reduce the risk for heart attacks and strokes. There are 6 lifestyle management changes that are recommended to reduce hypertension. In the first of this two-part video, we looked at weight reduction, DASH meal plan, and sodium reduction. In this video, we will address physical activity, alcohol moderation, and smoking cessation. As we reviewed in the first video, lifestyle modifications are evidence-based and can reduce a person's blood pressure as well as other cardiovascular risks. As healthcare professionals, it is important to learn how to motivate and engage patients to work on lifestyle changes to improve their heart health. Physical activity. Exercise. Not always a welcome intervention for patients. Let's call it physical activity and discuss some safe activities patients can do. It is recommended that patients engage in 20 to 30 minutes of aerobic activity 3 to 5 days a week, if tolerated. It is hard for most of us to get that amount of activity into our day, so suggesting this to your patients can really turn them off. Instead, encourage your patient to start at 5 to 10 minutes and increasing gradually to the 20 to 30 minutes. Evidence also shows even several small sessions a day is as effective as one 20 to 30 minute session. Remember, any activity, even if not aerobic, is better than no activity. A physical therapy evaluation is a good option to evaluate safety for ambulation, assess a patient's functional limitations, and make safe recommendations for physical activities. Communicate the patient's likes and dislikes to the team and let the patient select the activities. So what other activities are appropriate for older patients who are functionally limited? Some patients may have access to equipment in their home or in an assisted living setting like a stationary bike, treadmill, or steppers. Make sure the patient is safe with the equipment, adapt as needed, and encourage supervision if available. Other activities can include dancing or low-impact aerobic exercises. There are videos on the internet for free or DVDs for purchase if this is something a patient would like. Strengthening exercises are great for the heart and also for fall prevention. Ideally, strength training should be done 2 to 3 days a week in addition to the aerobic exercises. Have a selection of activities for the patient to choose from and change the activities weekly to prevent boredom. Chair yoga is great for patients with some safety issues or those who are chair-bound. There are many online videos available that teach chair yoga. Alcohol moderation. Alcohol consumption, especially abuse, is a risk factor for heart attacks and strokes. Alcohol should be used only in moderation. When you're assessing a patient's cardiovascular risk factors, you will need to find out how much alcohol they are consuming on a regular basis, not just if they drink alcohol. You will also need to find out how they define a drink. The guidelines indicate 1 drink is equal to 12 ounces of beer, that is 1 regular 12-ounce can or 12-ounce bottle. A drink is 4 ounces of wine, which is half of a cup. 1.5 ounces of 80 proof spirits, which is about 1/8 of a cup, is also 1 drink. Shot glasses can be different sizes, so it is important to get a measurement of the shot glass before using the shot glass to pour drinks. The recommended maximum amount of alcohol is different for women and men. Women should consume no more than 1 drink per day. This could be 1 12-ounce beer, 4 ounces of wine, or 1.5 ounces of 80 proof liquor. Men should consume no more than 2 drinks a day. This could be 2 12-ounce beers, 2 4-ounce glasses of wine, or 2 1.5-ounce shots of liquor. Smoking cessation. Evidence clearly shows tobacco smoke, including secondhand smoke, causes harm. There is a direct relationship between tobacco smoke and higher cardiovascular risk. Smoking cessation is critical to reducing cardiovascular risks. Who should be doing smoking cessation education? Primary care practitioners, hospitals, or home health? Quitting smoking is very difficult for most people, so education and support is needed in all settings. Smoking cessation is most effective when a person receives both behavioral counseling and medications. Unfortunately, only 32% of people trying to quit receive counseling or medications. People come with preconceived beliefs about quitting or the lack of personal strength to quit. We as healthcare workers need to ask the questions and listen to what they're saying. It is essential to ask about smoking and tobacco history, previous attempts to quit, barriers, and successes. Explain that patients do not have to do this alone. There are many people to help them quit, including their physicians, nurses, social worker, family, and others in the community. Educate and encourage them to think about using both counseling and medications to help them quit. Cessation counseling is effective to help a person consider quitting, even if the sessions are only 3 minutes in length. To learn more about helping your patients quit smoking, please view the other smoking cessation videos in this series. During this video, we've taken a brief look at 3 of the evidence-based lifestyle management interventions: physical activity, alcohol moderation, and smoking cessation. The Lifestyle Management Part 1 video includes the other 3 interventions: weight reduction, DASH eating plan, and sodium reduction. Teach and engage your patients to pick interventions they want to work on to lead them to a healthier heart. HHQI has the free My Healthy Heart workbook on our website. The workbook includes short sections on all 6 of the lifestyle modifications discussed in this 2-part series of videos. You can supplement with other tools based upon the individual patient's interest and engagement. We hope you were able to brush up on these lifestyle modifications. They should help you assist your patients in reducing their cardiovascular risk.